Well, welcome everybody. My name is Frances Donegan Ryan. I am the president of the board for the Center for Women and Democracy. And I could not be more excited to welcome you all to tonight's event. This is an event that we are doing in partnership with the Women's Commission of Washington State. The theme of our event tonight is the economic impact of the pandemic on Washington women. Our goal for this event is to help educate all of us on what has happened during the last 2 years of the pandemic, and particularly how it has affected women financially and economically, and particular focus on women here in Washington State. And the goal of this education is so that, one, we can understand what the current state is, and two, what can we do about it? How can we support each other? How can we lobby our representatives to ensure that as we build back our economy, as we restructure after this pandemic, that women are put at the center and forefront of that work, and the legislation that will affect us most, the business practices that will affect us most, the new schooling practices that will affect us most, that we have a voice in that and that we can influence that. And so that is our hope for tonight, that you learn the details about what's going on and that you take away from it what you can be doing in order to make impact and to make change. As I mentioned, we're here today by a joint partnership with the Center for Women and Democracy and the Washington State Women's Commission. And I would also like to do a land acknowledgement. So here, where I'm based in Washington, and I'm here in Seattle in King County, we just like to recognize that we sit on Native land, and that our prosperity on this land is due, in fact, to the ownership of that land by our local tribes. I would also encourage people to visit this website, native-land.ca. It's a great resource. You can look up your own locations or global locations and find the Native peoples who are from that land. And it's a wonderful resource to be able to know more about where you live and where the land that you toll or live or work on comes from. Next, I would really like to bring onto camera to introduce Regina, if you would pop on. So Regina Malvo is the Commissioner for the Washington State Women's Commission, the Executive Director, and I would love if you could tell us a little bit more about the Women's Commission.
Absolutely. Well, first of all, I'm so excited to be here, and we are always grateful for any opportunity to partner with the Center for Women and Democracy. So thanks for reaching out to us to do this special event tonight. I understand that it's the first in a series that you'll be doing this year entitled The Next Normal, Building a Just and Equitable Future for All Women in Washington State. And what an amazing way to start out the year. And again, thank you for inviting us to be your partners in this event tonight. So the Washington State Women's Commission is a part of the governor's office. And so I bring with me the governor's well wishes and his thanks to each of you who've joined tonight, both as speakers and on the panel and as participants, really to work collectively to think through, these are big issues that we're facing right now, and they're going to require big collaborative solutions. So grateful that we all had the opportunity to spend this evening together. The role of the Women's Commission is really to serve as a focal point in government to look at the issues that disproportionately impact women and to advise both the governor and the legislature on those issues. So again, we like to engage with community partners like CWD and others so that we're just tapping into the biggest brain trust possible as we work at, how to create new structures that will better serve, women and families. So again, welcome. I understand we had well over 100 registrants tonight, so we're very excited that there's so many other people that obviously care about this conversation, and I'm looking forward to having it. So with that, I'm going to go off camera, and I'll be back when you summon me. So thanks again to everyone for joining us, and looking forward to the discussion.
Thank you, Regina. So building on what Regina said, I wanted to share a little bit more, if you're new to the Center for Women and Democracy, about what we do. So we are a member-supported organization that focus on women's leadership and democracy and the values of democracy. We are a diverse community of powerful women leaders, and that we spend time with each other to foster really deep and meaningful connections so that we can learn from each other, support each other, and grow together. And we do this through education, through advocacy, and through providing a platform that allow equal access for women to share their stories and their lived experiences. And our motto is to inspire women to lead where they land. And we think that's incredibly important because you can be a leader in so many areas of your life and at so many stages of your life. And the Center for Women and Democracy is here to support you in doing that. And so if you're not a member yet, we'd love you to join us. If you are, and this is your first event in a while, welcome, welcome back. If you are a devoted member and you've been with us through the pandemic and our virtual programming, thank you so much for your support and your ongoing support. At the end of our event tonight, I'll talk a little bit more about what's coming next for us. But without further ado, I really want to kick off this discussion. So a little housekeeping notes before we start. We would love for you to join the discussion in the chat feature. You'll see that in your bottom Zoom menu. If you'd like to ask questions of the panelists, there's a Q&A box. Submit your questions that way, and then I will be able to ask the panelists those questions when we get to Q&A. We do have moderators, so if you have any problems hearing anyone, please let us know in the chat, and we can troubleshoot from there. So please help me in welcoming our first keynote speaker of the night. Her name is Diana Pierce. She works at the University of Washington. Diana, if you could join us on camera. Thank you so much. Diana is a longtime scholar, advocate, and leader in the fight for women's equality, and she's going to share her learnings and her passion and just her depth of knowledge with us tonight. And I'm so honored that you're able to join us. So I'm going to turn it over to you, and thank you again.
Okay, I'm going to try sharing screen here. See if this works. Hello, everybody. There we go. So I'm going to talk about the context of the economic impact of the pandemic on Washington women. And I'm going to talk about three topics today. The pre-pandemic gender and race and ethnic inequality in Washington state. That is, before the pandemic started, what was the state of gender and racial inequality? Second, about some data issues that make it hard for us to assess, and also calls us to think about which kinds of data we're using to look at the impact of the economic impact of the pandemic. And third, I'm going to talk about inflation, how much there is and who's experiencing it. I'll be using the self-sufficiency standard today as appropriate. The standard is a measure of income adequacy based on basic needs budgets for working age families. So it's how much it costs to meet your costs like housing, food, childcare, etc. The standard varies by family composition and place. We do it for about 700 different family types in each place, usually county. Sometimes we can break out a city like Seattle. It's calculated in 41 states and has been calculated in Washington state since 2001. The household is the basic unit of measure, as with poverty and other statistics on income adequacy. And we'll be focusing today on women-maintained households in Washington state. So the pre-pandemic status of women. This is a chart that shows a percentage of Washington state single mother households by race. So the highest one there is Latinx households. And my screen, people are over the end of it there, so it's a little hard to see. But what this shows, what the percentage of families that were Latinx women maintained families with children, single mother households, below the standard in 2000, in 2013, and then in 2019. So 2013, we were still in the depths of the Great Recession. They had a very slow recovery. For Hispanics, it went from 71% to 84%, and then to 76%. For Black families, it went from 64% to 78% to 69%. So particularly for Black and Hispanic families, they are now about 5 percentage points more higher. That is 5% more are below the standard than in 2000. So we're in 2 decades, we've lost ground, particularly for women of color. So coming into the pandemic, we were looking at increasing race and gender inequality. A second set of issues to think about is the data issues. First, the pandemic itself messed up data collection. I'm sure we're aware that the census was held on April 1st, 2020, but because we were in the middle of the pandemic by then, there was an inability to follow up on people. If we extended the collection of the data, it still is not representative. So it's tended to over-represent older, whiter, wealthier, and more educated households, which means that younger people of color and poorer households are underrepresented. And because of the way the pandemic affected data collection, the old methods of weighting, because we always underrepresent lower income and people of color for a variety of reasons. But those old weighting methods don't really work. So the census is basically saying, be very cautious about using this data, and particularly comparing it previous and subsequent years. But secondly, also, the usual measures are not as meaningful. So one of the things that has happened during the pandemic is a lot of women left the labor force altogether, so they're not counted as unemployed. So if we use, as we often do, how much unemployment there is, in fact, I think there were some numbers today that were released that said, well, unemployment, applications went up. It's not entirely meaningful, particularly for women. So using some of those things is not as good as it used to be. And there's a couple of other trends too to keep in mind. Government assistance programs from the monthly child tax credit, stimulus checks, extended unemployment, the PPP, the Paycheck Protection Program, all affected people's income. And this showed up, the supplemental poverty measure, it showed up as a decline of poverty from 13% to 10%. Now the poverty measures, both the supplemental and the regular one, really measure just destitution at the very bottom of the income scale. And so this is important. It did decrease destitution, but it did not increase people's well-being to the point that they are able to meet even the cost of their basic needs. Some of these programs, however, we don't know how long this will last. Some programs have been discontinued, like extended unemployment, and others' fates are still unknown. A second issue is a shortage of workers, the Great Resignation, and increased labor activism. And this is apparently increasing wages, but it's not clear whether it will continue, whether it will spread beyond Starbucks and Amazon and some of the, better known labor campaigns, and will it be enough to close the gap between wages and prices? Now, the third thing I want to talk about was inflation. So this chart shows for 4 different counties in Washington, the increasing costs. And you can see King County is the most. So this is for a family of 2 adults and 2 children, one school age, one preschool age. And so in Seattle, they went from those 2 adults from having to earn over $40,000 to now over $90,000 just to meet their basic needs at a very minimally adequate level. If you look at, however, if you look at inflation compared to the CPI, CPI is a consumer price index, and that's how we measure inflation. And I'm sure many of you have heard us talking about the 7% inflation rate. So this shows the inflation rate. If we had taken the self-sufficiency standard, which we first measured in Washington State in 2001, and inflated it, the blue lines are for Clark County and the red lines for Seattle, King County. So the blue lines, this shows what would, if we just update it with a CPI, this is where it would be. And this is where it actually is for this family in 2022. So we're up to, you can see that this has increased much faster than if we just updated the standard with the consumer price index. So to put it in annual terms, the average increase in prices overall this year, some years was more, some years less, but the average, according to the consumer price index for the Western region, was 3% per year over the last 2 decades. In Seattle, it was 6% per year. So every single year, more or less, some years more, some years less, but on average, it was 3% more than officially measured inflation. What this means is that, and we're seeing this in all different places. So in New York City, you see that over 20 years, the CPI increased 55% and the standard increased 81%. Even in South Carolina, it was one county, Spartanburg, the CPI increased 7% and the standard increased 15%, double the amount. Every place across the country, we're seeing this tendency. This means that people who are lower income are experiencing more inflation. There's more inflation in the basics like housing, food, healthcare, childcare than there is in the overall package of goods and services. So our low-income families are experiencing much more inflation. I think I'll stop at that point, and I can stop sharing the screen. So if there's any quick questions. Hello?
Hi, Diana.
Hi.
Sorry about that. Took me a second to jump back on. We don't have any questions submitted yet. What I'm going to encourage people to do is think about the questions you'd like to ask Diana based on the data she's just shown us, and we'll collect them and then return to the questions during the Q&A after the other female keynotes have spoken.
Okay.
Thank you very much. That was
Thank you.
That was incredibly interesting. I didn't know that data, so thank you. That was very helpful to set the foundation for the other talks we're going to have as well.
Okay.
Great.
Try to give you
Diana.
something to think about.
Yeah.
Okay, bye.
So our next speaker this evening is Sarah Calkins Holloway. She's a managing partner or senior partner with McKinsey & Co. here in the Seattle office. And she is going to talk to us about a report that her group has done. The title of the report is Women in the Workplace in 2021. So Sarah, in corporate America. And so Sarah's going to share with us her insights and data from that report. And again, drop your questions into the Q&A, and we will start collecting them for the discussion afterwards.
Thank you,
so much,
Frances.
Sarah.
Yeah, of course. Thank you. It's a pleasure to be here. I am going to share my screen as well. And let me just, in the interest of time, I'm gonna, I've tried to pull out a few highlights for this group from the report, and I'm obviously happy to take questions in Q&A or as we move along. The insights I'll be sharing come from the Women in the Workplace report, as Frances mentioned. You can see a little bit of information on the report here. It is a joint research effort between McKinsey and leanin.org. It's the largest study of the state of women in corporate America, and it has been run for 7 years. And so from the data that we gathered in 2021, you can see here with over 400 participating companies, over 12 million employees represented. It's a national survey, but well represented with Washington organizations. And we focus on the progress of women in the workplace through the data we collect in the report. A few of the messages that I'm going to try and highlight today from the 2021 results. The first is we are increasingly seeing women leaders in organizations stepping up in a number of ways. I'll show you a little bit of data on that, and that a lot of that incremental effort is going unrecognized in the workplace. The second is, not surprisingly, women are increasingly burned out and reporting higher rates of burnout disproportionately than their male colleagues. The third is we do look at data and results for women of color, and they continue to have more negative experiences at work, despite what their reported focus and awareness of DEI issues in the workplace. And of course, the impact of that is there is more work to be done by many stakeholders, and we focus in the report on the work that we see corporations doing and that we think there is increased opportunity to do. And those are the four main messages I'll highlight today. There's obviously a lot more richness in the report itself. So apologize, bear with me, there's a lot of data on this page, but we try to measure the progress of the funnel of women in the workplace. And you can see here at different levels reported in organizations from entry level up to the C-suite, the proportion of white men, men of color, white women, and women of color. And you can see those at each level along the funnel. You can also see along the bottom of the page how those numbers have changed over the course of the survey. So you see 2016 and 2020 data. And I'll call out a couple of things. The first is, if you just look at the difference between 2016 and 2020, we are seeing improvements at every stage and at every level in organizations for women in the workplace. This is positive news, particularly after a year or years such as we've had in 2021 and 2020. That said, progress, particularly at the C-suite, is insufficient, and we still see women significantly underrepresented at higher levels in their organizations. We've called out in prior iterations of the report what we refer to as the broken rung, which is that we see relative parity at entry level for men and women in the workplace, and then it's that first promotion up into managerial level roles at which we start to see a significant decrease in women moving into those roles versus their male colleagues. And then the last thing I'll call out is that if you just look at the numbers for women of color, the progress is insufficient. And if you look at each stage in the funnel, the representation of women of color goes down. Now, one thing we focus on in this year's report is, and I will call out here that this is not self-reporting by managers and leaders. This is reporting of people about their manager or leaders. And what they are telling us is that women in leadership are investing significantly, 60% more, in stepping into the many gaps and stressors that the pandemic has brought, providing emotional support to their teams. In addition, we saw prior to the pandemic and continue to see that women are taking up to 2.5 times the sponsorship load that their male colleagues are taking. And that they are more than 2 times as likely as their male colleagues to be spending a substantial amount of their time on DEI. This is amazing. I think there is much to be praised and probably much that is resonant with many of our personal experiences of the role that women leaders are playing. And I think what we call out in the report is that there has been insufficient recognition of that incremental labor that women leaders are putting in at a time when many organizations across many industries are seeing real workforce burnout and real labor shortage issues. Not surprisingly, what on this page we're reporting self-reported data from folks in the survey about their level of burnout. And if you look here, you can see between 2020 and 2021, both men and women reported increased levels of burnout. So you can see that 32 and 28 going up to 42 and 35% respectively. However, what we're seeing is that the gap between men and women between 2020 and 2021 has nearly doubled. We've previously reported, and I'm sure many of you are aware of the extra burden that many women have taken on the home front during the pandemic related to childcare and other household duties. And as we saw on the prior page, we're seeing women in leadership and women in the workforce taking on an incremental burden and taking care of one another. All of this matters because employees who report being burned out are significantly more likely to consider downshifting or leaving the workforce. It also means that those employees are more likely to consider taking a job at a different company with what they perceive to be a better work culture. And just a little bit of data to highlight the point I made earlier, which is that the experience for women of color who often experience being not just onlys in a room, but also double onlys. There is significant, what you're seeing here is for a number of down the left-hand side, challenges that you might see in the workplace, challenges of your competence and disrespectful and othering behavior, and what all women, what gender onlys and women of color, double onlys, report on each of those factors. And you can see that you're seeing those double onlys are up to 2 to 3 times more likely to see some of those disrespectful and othering behaviors. In the interest of time, the last thing I will mention for this group is we do focus on the report for some of the organizations who have seen more progress in progressing women in the workforce, and what are some of the things that they have in common. On this page, we report a few of the things that those organizations are doing to focus on diversity. They are tracking diversity metrics by gender and by race and ethnicity, so looking at those points of intersection. They are holding senior leaders accountable for progress and diversity in meaningful and visible ways. And they are minimizing gender bias in hiring and performance reviews. And there's a number of ways that organizations do that, but we would report this as a best practice that some of the higher performing organizations are sharing that they do, and that many more organizations could and should. And on this page, a few other things that top performing companies do in order to create a culture of inclusion. And what you can see here is providing mentorship and sponsorship programs for women of color. In the middle, focusing on that concept of intersectionality and focusing on education on allyship for all employees. And on the right, adjusting and ensuring there are sufficient policies to better support employees' well-being at all times, but particularly in this moment. With that, I will stop sharing my screen. And Frances, I'm happy to take any clarifying questions now, or we can hold questions to the Q&A portion.
Great. We don't have any clarifying questions. We have some additional questions, so I'll just hold on to them until we get to Q&A. And when you join us back on camera then.
Thank you.
Thank you so much, Sarah. And so next I would like to introduce Lauren Hipp. Lauren, if you could jump on camera, thanks. Lauren is the National Director for Early Learning in Washington State and momsrising.org. And she's going to talk to us today about her work with that organization and the advocacy that they do. So I'll turn it over to you, Lauren.
Hi, thanks. I will go ahead and share my screen. So My name is Lauren Hipp. I use she, her pronouns, and I'm the National Early Childhood Director for Moms Rising. And I'm really thrilled to be here to talk to y'all about the intersection of gender equity and childcare and what that means in the pandemic. So first, a bit about Moms Rising. We're an online and on-the-ground grassroots organization with over 1 million members across the country, where we work to increase family economic security and decrease discrimination against women, and centering our movement building on those who are most impacted by policies. So before I begin, I want to start with really contextualizing the childcare system that we know today. And unsurprisingly, childcare has its roots in racism. Historically, in America, paid domestic service work or caregiving work that encompasses childcare has been the domain of women of color. And starting with enslavement at the founding of our country, enslaved Black women were forced to care and breastfeed white children. Fast forward to the post-industrial revolution, caregivers were largely relegated to women, and it was done unpaid. It was done, quote, out of love, enacting much of the gender dynamics that we see today. But this wasn't the case for all women. Pay inequity for Black men coming out of enslavement and for men of color contributes to a higher proportion of women of color in the workforce than white women. And domestic workers, including childcare providers, are completely left behind. They were intentionally locked out of the Fair Labor Standards Act of 1938 because they were not white. Labor standards were then codified for white, quote, professionals, paving the way for caregiving work and childcare work to be undervalued and underpaid for decades to come. That would impoverish Black and women of color for decades. And as intended by racist laws, moving forward into the 50s and beyond, Black women were confined to working in domestic work like childcare while being paid poverty wages, and this continues to today. And then the Comprehensive Child Development Act of 1971 comes into play. It provided us with an unparalleled opportunity to invest in early childhood and create a universal childcare system, the ones that we, dream about. That would respect and invest in childcare and the workforce and support the needs of children and families. This was vetoed by Nixon, and he relied on antiquated gender concepts and ignored the reality of American families needing two people in the workforce. Additionally, Southern white segregationists lobbied against this bill hard. They ultimately killed it on the grounds of preserving the nuclear family unit, and they wanted to maintain consolidated white segregationist control, particularly in Southern states, stripping Black women and women of color of any hope of control over the early childhood system of which they have built. So I just wanted to ground us in this is the evolution of our system, and this is how we find our childcare system today. And the pandemic has exacerbated the problems, but our system of childcare has been deeply broken. It's been broken for families for as long as we have had childcare. It has not worked. Childcare, ask any mom. They're going to tell you that childcare is hard to find and it's unaffordable. Childcare costs more than college tuition in the majority of states. On average, tuition for 2 children in childcare costs nearly $20,000 per year, and that accounts for more than 1/4 of the median family income. A majority of families live where childcare is hard to find. There are long wait lists, they lack the match of family needs, it's out of reach. And this disproportionately impacts the ability of mothers to participate in the labor market. All of this obviously exacerbated by the pandemic, when 3 in 5 of the jobs lost due to the pandemic were jobs that women held. Women were more likely to be in what were deemed essential professions during the pandemic and have been disproportionately impacted by COVID and job loss. We also know that the child workforce is undervalued and underpaid. And not surprisingly, women and women of color and immigrant women make up 94% of childcare providers. And I just want to underscore that that is disproportionately women of color and immigrant women. They're paid poverty wages, the median wage being $9.62 an hour. This is by design. Childcare workers struggle to make ends meet for their own families. 3/4 of childcare providers worry about having enough money to pay their own monthly bills, and over 50% worry that about their own ability to feed their own children, much less their ability to find high quality childcare like the kind they provide for other people's children. And this has only worsened during the pandemic. And we know that 2/3 of small business childcare providers struggle to break even during the pandemic. And without significant intervention, we really risk losing over half of the childcare supply in our country. So unsurprisingly, the childcare crisis combined with the pandemic is really leaving women behind. Women and mothers are disproportionately impacted by childcare supply and affordability issues. It's estimated that families, and particularly women, miss out on $8.3 billion in lost wages due to lack of childcare. Wages foregone because parents are forced to quit their jobs because of lack of or the extreme expense of childcare, or having to reduce their hours due to the lack of access to childcare. And this burden primarily falls on women. Childcare is a crushing expense for families, and women are forced into a double bind. For those who want to be in the labor force, they often wear their income against the expense of childcare. And for women that want to take time out of the workforce to care for their young children, they face effects on both their short-term and long-term financial security. In either case, women lose out in their retirement and Social Security earnings later in life. Women are in a no-win situation. And even if you can find childcare, if you live in one of the many areas of the country where there is inadequate supply of childcare, women again bear the brunt with the labor market participation of mothers suffering in these geographies, but paternal employment remains unchanged. Despite all of that, state and federal policies fail to fix this broken system. Federal and state subsidy systems are tied to work participation. That creates a significant set of barriers for families in fully participating and benefiting from these programs. And only 1 in 7 eligible families actually receive federal childcare subsidies. And it's important to mention that these subsidies fail to cover the actual cost of quality care, which further impoverishes women and women of color who make up the system. The impact of the childcare crisis is really compounded by the lack of pro-family policies. We have gender-based pay inequities where women are paid 80 cents to the white man's dollar, and this is obviously worse for women of color, for mothers of color. And wage gaps are persistently worse for mothers and women of color. And then there's also the lack of paid family leave, which contributes to lost wages, depletes women's family economic security, physical and mental health conditions and risks, and more. So what comes next? We're in a pandemic that has brought this boiling childcare crisis into hyper focus. Companies can't ignore it because, a significant proportion of their workforce is impacted by childcare challenges, right? 75% of parents during the pandemic were working at home with children in the house because of childcare challenges. Like, this has been brought front and center from every aspect of society to see the problems that women and mothers have known for a long time. We're at a decision point on how we act or don't act, and that will determine the childcare system that we have tomorrow or a system that we don't have. Right now, Congress is obviously considering the Build Back Better Act, and it includes massive investments and policy improvements to advance affordable childcare and universal pre-K. It includes provisions to adequately compensate the early childhood workforce and better value the work of caregivers. But we must reckon with the fact that childcare, like so many policies, are inextricably linked to our hopes for gender equity. Childcare is important for the sake of child development, and while that seems to be the acceptable argument to propel it forward as a serious issue, it has to be recognized that it is equally important because it matters to the well-being of mothers and women, and that the well-being of mothers should and needs to matter. And that concludes what I was planning to say. Are there any questions?
Thank you so much, Lauren. That was, well, we had lots of comments and +1s and thumbs up for providing the historical context that you did. I think a lot of people, that was new information for a lot of people. And so incredibly important for us to know as we look at the crisis we're having now, we look at the way it's been designed and structured and why it's put us in the place we're in now. So that was very, very helpful. Thank you. If I could ask all of the keynote speakers to join me on camera, we do have questions. And what I'm going to do is read the questions out loud. Some of them are directed towards one person in particular, but some of them are just general. So if you have input you'd like to share, that would be wonderful. So the first question I'm going to ask is, are there any programs and Lauren, this is probably for you, are there any programs or legislation in progress to help improve the childcare crisis in Washington that we should be aware of?
Yes. Last legislative session, Washington State passed the Fair Start for Kids Act, and it does a number of things to improve the early childhood system in our state. But most significantly around childcare is it works to reduce the amount that families are paying. And I can drop in the chat a website for more information on how that works out for families, but it essentially reduces copays and expands the eligibility for families to be able to afford care and to better pay for the true cost of care.
Great. This is sort of a follow-up from that question. What changes can be made or policies implemented to increase the availability and affordability of childcare while also maintaining a living wage for the childcare workers? So I think you addressed a little bit of that. Was there anything else you could add, or anything else Sarah, Diana would like to add in terms of how do you maintain that living wage while making it affordable for the parent?
The problem with childcare is it's a failed market, right? This childcare early learning is a public good, and we should be thinking about it and treating it like we talk about K-12, right? Because our subsidies are inadequate and are not paying for the true cost of quality care, and it is expensive to care for infants and toddlers, right? We want ratios that reflect the needs of our babies and toddlers. We want people who are well trained, and we want to compensate them for that time and that training. So it's expensive, right? But because the government isn't investing, and we as the public are not investing in that then falls to private pay and to families to fill that gap. And families simply cannot do that. It doesn't make sense. So what we need are programs that will pay to the provider the actual cost of quality care. And that's the mechanism to increase wages and compensation and benefits for early learning providers, and to ensure that families have access to affordable care.
I would add that.
Go ahead, Diana.
Yeah.
I would add that I think it's important to think about universal pre-K. That ultimately, trying to subsidize childcare for people that are eligible is just, it's hard. As you said, it's only 1 in 7 families gets it. If you make it universal, so it's just like kindergarten, it's there for everybody. New York City is doing that. They've done it for 4-year-olds, and now they're working towards 3-year-olds, and having universal childcare. They're doing it on the school day, so you still have a little bit of a before and after school problem, but they can do wraparound once you've got the school set up with preschool. So I think that's the key, is to go towards universal programs, just to reach everybody and have more equity.
I was just going to add, I love what Lauren and Diana said about the solution, but I will just add, from the perspective of the Women in the Workplace report, the costs of poor childcare and lacking childcare, it is also seen in the presence that both the burnout rates that women report in the workplace, and also the decrease in the women reporting higher levels of considering leaving the workforce, many of them reporting that because of the burden of childcare that they are seeing on the home front, particularly in the last 2 years.
There was another question about, and Diana, you answered part of this, if there were statistics comparing the United States versus other countries in the effectiveness of their early childcare programs. I love that you mentioned New York, Diana, that there are clearly other states who are doing programs that maybe our state could emulate in some way, but I don't know if any of the three of you had more international lens on comparative between us and say other countries around the world.
I know that in France they have what they call a creche program. And I think one of the interesting things that we haven't really thought much about is that they create networks of child care centers and family child care homes, because there's a lot of child care that doesn't happen in centers, also happens in family homes. And by putting them together, they can support each other, have substitutes that they share. So it allows the providers to, to have a day off to get to the dentist and, things like that. And also they have like shared facilities. So there's a little gym that all the child care centers and family homes share, that they can bring kids to. Maybe have to wait till after the pandemic, but that kind of thing where you're creating a network and a support system rather than expecting somehow we're going to grow this like scattering flower seeds. We're going to grow childcare centers all over the place that will be accessible to everybody, instead trying to provide support for individuals trying to meet this need.
Yeah.
There are a lot of models across, across the world, but certainly in Europe that have been comparable to what we're hoping to build, that are more universal in nature. Finland, all across Scandinavia and France, that provide sort of this public infrastructure that we are aspiring to as seeing this as a public good. It's a little bit different because we have such a different orientation, and frankly our orientation towards individualism, I think, is one of our barriers to getting us to a place where we see the collective value of early childhood and the gender equity issues within it.
Yeah, I know growing up in Ireland that they have junior infants, and then pre-K. So you start going to your K through 12 school at 3 rather than at 5. And so you only have to supplement childcare, like you were saying, Lauren, that wraparound time Diana, you were saying before and after school care. But you start going to school at 3 rather than 5, which lifts a lot of that economic burden. But Donna had a question, continuing to build on this topic. We'll switch topics in a minute, but continuing to build on this topic, based on what you said, Diana, about New York doing this in public schools. What impact does that have on small businesses doing childcare?
So I think the nuance in thinking about a universal pre-K is that to be realistic about how our childcare system works is preschoolers are the cash cow of the childcare industry. So you rely on preschool to make up the difference and to keep your childcare afloat. So if you institute universal pre-K and it's not a mixed delivery model, and you're not thinking about how do you then subsidize the infants and toddler classrooms to bring wages up commensurate with what you're doing in your universal pre-K program, you're going to crash the market for infants and toddlers, and you're going to hurt the small businesses that serve 0 to 3. It can be a significant problem if you go in, and almost every place that has instituted UPK without universal pre-K, without attending to the needs of 0 to 3, has already experienced this. So we need to make sure that we're thinking about the full spectrum, like what is happening for infants and toddlers, and how are we treating 3s and 4s and 5s. And let's also be realistic that these are the same kids from the same families, and like parents aren't necessarily saying, I need a childcare, I need pre-K. They want a safe, enriching place where their kids are going to be loved and cared for, where they're going to be, invested in, so that they're ready to go to school with everything that they need.
I mean, I think if you conceive of childcare like K-12, you are thinking of it as a public good. So I think that does challenge the model of for-profit, private childcare. And I think we do have private schools, K through 12, that coexist with public schools, but establishing a sort of a public responsibility, I think, for children. I think pre-K is just a next step down, and hopefully eventually we'll go to 0, to the 1s and 2s as well.
There's lots of chatter or comments going on in the chatter as well around this, around the childcare topic. I wanted to switch a little bit to some of the other things that we touched on across all 3 of the presentations. So I'm just looking at notes and I'm looking at what questions are coming in. And there was a question around, and Sarah, you might be able to comment on this, around, you spoke about one of the burnout reasons was a lot of this mental health care and companies having to institute additional layers of benefits that they may not have had to before. And we were wondering, have you seen programs around mental health care that have worked, that are making impact? And if you had any examples of those, or is it just providing, a subscription service to Mindful or Calm or one of those apps?
I think it's a great question. I think, unfortunately, that the data is too young to yet know which specific types of programs are seeing the best results. From much of the data that we collected in 2021 and some of that looking back at full year 2020, what we can see is that organizations that have instituted net new policies that support a number of things, that support flexible work, that add benefits related to childcare, that add benefits related to mental health, that their data around the progress of women in the workforce looks significantly better. And so we know that organizations who are making changes, who are acknowledging the gap and are actively working to fill it, are seeing less degradation of the pipeline for women and more significant advances. I personally, I would say, honestly, there's been so many flavors of innovation in terms of mental health supports. I don't think we know yet which of those are, you listed a couple right off the bat, Frances. I don't think we know yet which of those are showing the highest correlation with reduced, for example, burnout rates, or with reduced levels of reported anxiety, et cetera. But I do think, I mean, honestly, we're all a little bit living in a time of test and learn, because we've now, but we're now nearing the 2-year mark. A number of organizations had already put in place policies prior to the pandemic, and if anything, there's just been greater and greater need and greater awareness since March 2020, I guess.
Yeah, I have a personal follow-up from a personal question follow-up from that. I have a friend working in the UK in journalism, and he had a tweet today saying that nationally they're going to start shifting towards a 4-day work week. And some other countries are already doing that. I believe Iceland is one, and we're seeing certain companies, typically more in the tech startup world, that are starting to play around with that idea. And I was wondering if any of the panelists had thoughts around a 4-day work week in terms of, is that going to be helpful for women or detrimental? Does that mean an extra day of childcare if you have under 5-year-olds? Is the fact that you have an extra day to recover from the stress of all of the things that you're dealing with? I was just wondering what the panelists or our keynote speakers, I should say, thought about that idea, and if you have any insights on that.
Is it 4 days of 8-hour days?
I believe so, yes. It's not 4 10s. It's a 4 8 hours in a corporate sense, I imagine. So for whatever you typically work.
Because healthcare, my daughter-in-law is a nurse at Walter Reed, and they have 12-hour, 4-day, 12-hour days, which requires, when you have a longer day, it requires then other kinds of non-traditional childcare to make that work, because it's outside of, you can't possibly find childcare that's going to cover that, both the beginning and the end of the day. Most childcare is, 8 to 10 hours total.
Yeah.
So that's one issue of whether they're just decreasing the number of trips to work and back, or is it actually decreasing hours to.
Yeah. Because I know there's been a lot of debate around whether this working remotely, working from home is more beneficial or less beneficial, particularly the impact on women. So I didn't know if there was any data on that yet, Sarah, or is that something we'll probably see data around next year when you do the report?
That would be my suspicion. No data in the report we've collected thus far.
Okay.
And some of the issues of childcare are exacerbated during the pandemic because of health requirements. So childcare centers have to keep the kids in pods, in the classroom, whereas they used to mix them, and they were able to be more flexible. If a childcare teacher was absent, you could combine things like that, and you can't do that now, which has made childcare even more difficult to manage. You can't have mixed groups on the playground because of the possible transmission. That way, if one child gets sick in one classroom, you only have to close that classroom, that kind of thing, and that just complicates. It's difficult enough to manage all the childcare providers and schedules and that sort of thing.
Yeah, we had another comment on the chat saying if for hourly workers, if there were fewer hours in a work week, it could be detrimental to hourly workers versus an annual salaried worker who has that standard pay throughout a year, even if hours fluctuate up and down. Well, this has been incredibly interesting. We've actually reached our time. Were there any last thoughts that any of you want to share? Any last resources? Lauren, you've shared some links. Sarah, I shared the link to the report in the chat. There have been a lot of requests for the slides that you shared. So if you're willing to do that, if you can just let Connie or I know afterwards, we will get those out to everyone who attended today, if you're able, if they're publicly shareable. And just another big thank you from us. It was incredibly valuable to learn this. And I think having a better depth of knowledge of the data in particular and historical context is really going to help us as we go into our panel discussion, where we'll talk more about the activities happening particularly in Washington State.
I wanted to add one thing that I forgot. We're at the center. They've done a study of Washington State working parents and the impact of the extended child tax credit and the child tax credit, the expanded child care and universal preschool provisions. So 31% of working parent households in Washington State have income below the standard, don't have enough to meet their basic needs. If you implemented all of those, which we did implement temporarily, it would reduce that by 12%. So instead of 30%, it would be 18% would be below. So it's more than a third of those parents would be brought above the standard by meeting their costs. I mean, one of the reasons to pay attention to costs is, poverty or income inequality is a ratio between income. So maybe wages are rising, but if costs are rising faster, and we're not meeting those costs through subsidies and universal programs, then people are just further behind.
Yeah, that's a really eye-opening statistic.
Yeah, I mean, the Build Back Better provisions really would make a difference for working parents.
Wow. If there are any reports that you'd like us to share directly from the center, Diana, let me know and we will get those out as well.
Okay.
To anyone who's attending, yeah, we can share them as well. Ladies, thank you so much. I want to thank everyone for joining us for this first hour. We still have more to come. So we are going to take a quick break. Let me just share my screen. So we are taking a quick break. I encourage you to grab a water or a glass of wine or whatever your drink of choice is. And come back and join us for the panel that we will have starting. We'll kick off that panel in, so look at my watch, in exactly 7 minutes at 10 past 6. So take a moment, take a break, hug your family, and then join us for our panel discussion that is coming up next. Thank you. I hope you were able to grab a little break and do what you needed to do. I am really excited for our next hour and want to thank you for both joining us for our keynotes as well as staying for our panelists. This panel is really going to showcase key women in Washington State who are working on impactful programs that are really making a difference for women, or that will make a difference for women financially and economically. And one of the women in our state who's doing that is Kate Eisler. Kate is a longtime advocate for women, both in the workplace, in business and technology. She's the founder of the W Marketplace, which she's going to tell you more about, and she is our moderator for today's panel. And I am going to welcome Kate to join me on camera. Thank you so much for being here. You're such a great friend and a great advocate and ally. And I'm actually going to turn it over to you to introduce our panelists.
Thank you, Frances. It is such a pleasure to be here with all of you. And as Frances said, I am a very long time advocate of gender parity and really an activist for women's rights. And as I listened to those speakers, I wish that I could say I was really surprised at what they said. I wasn't, because we hear this a lot and we feel this. And I know that every one of us on this call